Hey, it's Christina. I am doing this video today to help give you some tips and ideas on what you need for after knee replacement surgery. Some of these ideas may not be for what you would like to do, but these are the things that I did for my experience, and I just want to share those with you. First and foremost, you want to get comfy clothes. So nice, flowy, comfortable dresses, comfortable shorts, or comfortable PJs, loose fitting sweatpants for the guys. You also want to have shoes that you can just slip on. So there's a brand called Kizik out there that you can use that are super easy to just stand up and slip your foot in without even needing to bend over or bend your knee. I believe Skechers also has a version of these. I wouldn't suggest using anything like slides because those are not as secure and you don't want to have anything that could cause you to trip. Make sure you check with your benefits with your insurance to see what the doctor or the hospital is going to send you home with. But if they do not send you home with a walker, crutches, or a cane, make sure you get one of those yourself. A reacher or a grabber is also very important. That way you can grab and reach things that may be too low or too high, or for items that are just a little bit out of your reach and you don't want to have to get up to get it. So a reacher and or a grabber is a great idea. Another great tool is a leg riser, and this is just something that you can put over your foot and it helps you to lift your leg onto a couch or to your bed. When you leave the hospital, you want to make sure that you have a vehicle that you can get in and out of with plenty of room. So I know this is not as easy for everybody to you can't just go get a car, but make sure whoever's taking you has a roomy vehicle for you to be able to get in and out of, because as you know, we have just had surgery, and so you may not be able to bend your leg enough to get in a tiny car. Make sure you have some sort of organization plan in place to keep you and all your medication on track. You're going to have several medications to take at different times. So what I did is I had a notebook, paper, and pencil, and I organized myself to determine what times and what medications I need to take, and I set alarms on my cell phone so that way I didn't forget when it was time to take those medications. Make sure all your medications are filled and are at home before you get home. Also pick up some stool softeners, because if you're on narcotics, which the majority of us are, those things can cause you to be constipated, and you don't want to be constipated. If you are tall like me, I'm 5'10", having a toilet riser with handles was absolutely a lifesaver for me. Standing up and sitting down from a toilet could be very challenging, and it's really not that easy with a walker. It is doable, but if you have a toilet seat riser with handles is the magic word, that will greatly be an asset to your bathroom activities. Having a long handle sponge will really help you when you're in the shower. Also, body wipes or wipies to help wipe you down is also came in handy for me. So for me, because I had a nerve block, I was not able to shower for the first 3 days. So those body wipes came in handy for me. After that, I was able to take a shower, but I had to limit myself to 5 minutes so that way my wound and my dressing did not get soaking wet. And so having a long-handed sponge helped reach places that you otherwise wouldn't be able to reach without. If possible, make sure you have a support person at home to help you for at least the first couple of days, ideally the first couple of weeks. That way they can help you with preparing your meals, helping you put ice in your ice machine, moving things around for you, taking care of pets if you have them. Make sure you have some ice wraps that you can keep in the freezer. Most of us come home with an ice machine that we wake up with after surgery. If you are not given an ice machine, I would highly recommend that you buy one for yourself. The ice machine is going to help keep your swelling down, and so therefore you're going to need ice. I would buy a large bag of ice at a time, or probably the best idea that I was given was get about, a 12 pack of water bottles, either the small 8-ounce or the larger 12 to 16 ounce, and freeze those. Freeze about, I would say 9. And you can use those in your ice machine instead of ice. Ice melts fairly quickly, and the frozen bottles of water will last you a lot longer. Have a thin towel or a pillowcase that you can cut to put over your leg underneath the ice wrap, because you don't want the coolness of the ice to give you like a freezer burn feel. And so having a thin towel or pillowcase will help protect your leg. I had a leg compressor to prevent blood clots, and so that was something that I purchased and wore, because the last thing you want to do is be recovering from a knee replacement surgery and then wind up with blood clots. And lastly, one of the things that really helped me was a TENS unit. Some of us are not able to have prehab before our surgeries, and so we are super weak out of surgery, and our muscles don't really want to fire as quickly as we would like them to. So TENS unit was something that helped me kind of bridge that gap. So these are the things that I planned to get ready for after my surgery. I hope these tips are helpful for you. If you're not following me, please do so, and I invite you to go back and look at my other videos to just take a look at my full journey and to see other tips and guidance. Thanks for watching.